Welcome to You Don't Say, the podcast where we bring you real talk, expert advice, and practical strategies for all things speech and language.
We're Highland and Nikki, speech language pathologists here to break down communication challenges, share mentorship insights, and help you make a real impact.
Whether you're an early career SLP, a clinical fellow, or a seasoned professional, or you're just curious about the power of communication, we've got you covered.
Let's dive in.
Welcome to You Don't Say, the podcast by the Mentorship Collective. I'm Highland.
And I'm Nikki.
And we are back, and we have some exciting updates for you all. We actually presented at CSHA last week. So for those of you that don't know, CSHA is the California Speech and Hearing Association, and it was a great talk. We talked a lot about the importance of strong mentorship, as well as training and access to opportunities for coaching, mentorship, and support in your clinical fellowship, and how that decreases burnout. We were really surprised to learn about the statistics that lead to burnout. So 60% of clinical fellows feel burnout, which is wild, and so many people have left our field because of burnout, and the same for supervisors. So it was really interesting to be able to speak to a large group of clinicians who were feeling the same pain points that we were feeling.
Absolutely. And I think it's one of those things that you think about how we have 70% of SLPs have a waiting list. So we have all of these SLPs who are burning out so soon, and yet we have a giant waiting list across the field, across the nation. And so it's just growing and growing, and we're just kind of in this crisis mode. There's too many kids to be seen and not enough professionals. So we definitely dove in a lot in our talk on how we can help support mentors as well as CFs, and understanding that there is help, there is support. And I think a lot of the feedback we were getting is it was almost a rite of passage. Like, you should struggle. Like, that's how you become an SLP. You just struggle. And I think things have changed a lot in the last 10 years from when we first graduated to now. And the mindset is really different. So we don't have to just struggle. It's kind of like when you enter motherhood. In the past, it used to be, don't talk about it. You just struggle. And as someone who just entered motherhood, I'm talking about it with all my friends, because there are so many things that you just don't know that you don't need to know until you're in it. That's part of it as well. I didn't need to know all of these things about being a mom until all of a sudden I had an infant, and I was like, oh no. This is hard. And that's kind of like your CF, right? You don't need to know all of these different things until you're in your CF. And so that was something that we really kind of helped talk about, or not even just help talk about, but we discussed at length with a lot of the participants, hearing their input and their ideas, and some of the input of just struggle it out. And that's part of how we do this is detrimental to a CF as well as a mentor. We just shouldn't throw the mentors in and just expect them to also understand how to help support CF. So I thought it was a lot of fun.
Well, and I have friends who have left the field because of burnout reasons. Honestly, it's not that they didn't love being a speech language pathologist, and it is really sad because they were and are still fantastic SLPs, but they chose a different career path, and it was honestly because of the burnout, that feeling of stress, as well as mentoring. You know, they also had opportunities to supervise clinicians, and they loved it, but they didn't feel like they had support in being a strong supervisor. So that's something that we're hoping to bridge the gap between that academic world and the clinical world. And we know that we have to bill. We're business owners. We own our own private practice as well. So we know, we have that background knowledge of knowing that there has to be a balance, right? There has to be this balance of billing and seeing clients and treating to sustain a business. And then, you know, also quality of care and quality of life for the therapist, because that's how you're going to sustain the optimal quality of care for patients. You're going to keep people in the field. So it was a really great talk, and CSHA is really cool because it's a large community. There were so many therapists there, and it was really, really exciting to share that info. So that kind of dives into our talk today. So we've gotten a lot of questions about, how do I find the perfect CF for me? What does a CF even look like? What are the questions that I ask when I'm interviewing to even, what are the red flags to look out for? What are the green flags? Well, we went through a lot of those in one of our other episodes. And we also created those free resources for y'all that are on our website that give you an entire list of questions to ask in your CF interview, to look out for those red flags, green flags, what to ask, as well as a visual roadmap and guide for you as well. That's also why we created our clinical fellowship interactive mentorship support program as well. But we wanted to dive more into kind of what the experience is about and what to expect. Because again, this is something that I don't feel like anyone can really prepare you for in graduate school. I mean, Nikki, I'm sure you feel the same way. I feel like grad school they give you all the tools that they can, but they can't fully give you everything for that real world experience. And that's what we want to kind of prep you guys for in this episode, is what to expect and kind of how to think about your CF.
Absolutely. And even starting with knowing that who you are right at the first day you start your CF and the next 3 months within your CF are going to be really difficult. Highland and I have talked at length about how the person we met at the interview who's bright and bubbly and excited and motivated comes in day one and almost just vanishes. We're like, oh no, where did this person go? And for about 3 months, the stress of doing something new and feeling a little bit lost can really weigh on you. And it can actually change your personality a little bit without meaning to, because you're just almost in sink or swim and you're kind of doing a bit of both of them and you're doggy paddling while you're doing it. So it can be really stressful. So understanding that that's okay. If you feel like you're not your normal, typical self for the first 3 months, it really is okay. It's not something that I would put off immediate warning bells of this place is not for me, unless there's something else toxic going on. But it really is understanding that even if you are a super strong clinician already, you feel very confident, sometimes you might come in and you might be a little bit overconfident. You want to prove to everyone that you can do this. You do not need help. And that can be as detrimental as someone who's extremely anxious and too afraid to try anything. So it's understanding, where do you fall along this kind of continuum of how you're showing up, how do you feel, and what is the input you're getting from your CF supervisor too.
And I think, we can even dive in a little bit deeper into when we say you're not going to feel like yourself. What does that mean? What does that look like? Well, what we mean by that is when you go from graduate school to a full-time job as a clinical fellow, regardless of what, setting you're in, whether you're in a school, a private practice, a medical setting, you are opening yourself up to a ton of change. And the sooner you can start preparing your brain for that change, the better, right? We know that sometimes preparing our bodies and our brains for that anxiety and that change, and how to problem solve, what are some strategies that we can use to help with our anxiety and our energy, organizing our time, organizing our thoughts, what kinds of narratives are we telling ourselves in our brains? So many strategies that we love to teach clinical fellows, and we train them on to use because actually they're great to use in your daily life, not just at work. But that's what we want you to think about, because you are going to go from academic setting, and some of your programs you might have done 40-hour per week placements, clinical placements, but some of them don't require those 40-hour per week placements, because you can get your hours without doing the 40 hours per week. But you go to being completely independent. You are an independent practitioner. You have a lot of protocols that you're about to be taught, right? A lot of procedures at your new facility, a lot of requirements. You're going to go through a whole training period where you are going to feel like you are, I don't know, what would you say, Nikki? Like, you feel like you're in like school again, like high school again, a new class, or riding a bike, or...
You're kind of almost just right back at the beginning of grad school, where by the end you're like, okay, I can actually do this. I made it through. This is really hard. And at the beginning of grad school, you're just, I was drowning. It was a lot. Totally. And you're judging yourself, whether that's right or wrong. You're comparing yourself against your peers, and that feeling of not feeling adequate.
Yeah.
It can be really hard.
Yeah, that's it. So that's a good comparison. That's what it feels like, to give you guys an idea. Is it feels like you are starting all over again, because you are. This is going to be a very different experience than graduate school. However, the difference is you have the tools that you need in your tool belt. It's just learning how to use them, and learning also some of those soft skills that we don't talk about a lot in graduate school, which is how to take feedback, how to be open to making mistakes, and how to be, open to all of this discomfort all at once. And so that's the best way that you might have some other ideas, Nikki, but kind of depict how you're going to feel in those moments.
Yeah, you're going to feel a lot of probably imposter syndrome as well of I'm not really ready for this. And part of it is you aren't quite ready. And that is okay. Like we kind of throw everyone in. We're like, just go see all these kids and you get a caseload. Sometimes you have all these IEPs to do. And you have to talk to families and you have to tell them what you've done in these sessions at times, at least in private practice and in the medical setting. You're talking to these families and you're telling them from day one, first session, this is what we did today. This is what we worked on. And that can be really hard to synthesize for so many different types of kids throughout a single day. And I think that is where that imposter syndrome comes in, because part of you isn't really prepared and part of you will never be fully prepared. Yep. So it's this jump into the unknown, and at the same time you're expected and parents are expecting you to know what you're doing. So it's a lot to take on. It's really a lot, especially as we're talking through it. I'm like, oh my God, this is a lot.
I know.
A lot.
It's giving me that stress again of that feeling of like walking into high school for the first time. I remember is how I felt, that anxiety of, because you're also meeting new coworkers. You have a new supervisor, a new boss. So you add in all these other factors that it's not like, okay, I go to school and they tell me exactly what to do. No one's telling you exactly what to do anymore. So you have to flex muscles for critical thinking and problem solving more independently now. And no one really preps you for this kind of rip off the Band-Aid moment of, because ideally we're all going to have this fantastic supervisor that's going to help us along this journey like a little mother duckling, but that doesn't always happen. And it's kind of that sink or swim moment when you're thrown out into the deep end and you have to figure out, what are my tools around me? How do I survive? That's what it feels like. For the first 3 months. I think that is so accurate. It just feels like survival mode, and that is normal. And I think it's so important for us to normalize that, right? Kind of like you mentioned about being a new mom and all the things that we need to normalize about that. You're going to feel very stressed, and then you should start learning the tools that you need to get through those stressful moments.
Absolutely. And after 3 months, you should start to feel a little bit more in your own skin. You should still feel a little bit unsure. You should still be asking questions, and you should always be asking questions, but you should have a little bit more faith in yourself at that next 3 month period. And by the last third, you really should feel confident. We're just kind of fine tuning at that point. You already know you're never going to know everything, and you learned how to figure it out. But if you're finding that in the second half or the second third and the third, you're still feeling like this is not, I don't feel confident, that means you need more support. That means you need to ask for more support from your mentor. You need to look for external mentorship, take our program, because it shouldn't continue for 9 months. It should not continue for 6 months. You should not feel, and this is not to make anyone who's feeling that way feel like there's anything wrong. It just means don't suffer through it and let yourself get to the point where you don't want to be in this career. Because that's what happens. Is a lot of the women that we've worked with who have moved from different placements and then their CF somewhere else, they were so burnt out by the first placement, they didn't feel confident, that by the time they got to us, they felt confident by the end, but they were just like, I just don't know if this career is even for me, because they had already been so burnt by so much. And knowing that you shouldn't feel like that forever. If you're feeling that forever, there's help.
Absolutely.
You don't have to feel like that. It's not a rite of passage. This does not make you a better SLP by just struggling through it. I think that's something that is really hard. I think it's still accepted that today that we should just, that the rite of passage is the struggle. Like you need to struggle.
Yeah. And I agree with you, because why would we want to struggle? Because at the detriment of not only ourselves as clinicians, but also the clients. Because the goal is to provide high quality care for our patients and also for us to continue to grow and learn as clinicians. And so we do that by asking the questions and seeking the help. So this brings up a good point. We had a CF that we worked with who actually shared with us that she really didn't know what she should be asking in her clinical fellowship. And I think that is so important, because you know what? I didn't either. I remember being there that first 3 months especially and thinking, I know I probably should be asking questions to figure out what to do, but I have no idea what questions to ask. I don't even know that I need help. I knew I was struggling. I knew I was probably crying too much. I knew that I was taking home work too much. I knew that I was way too stressed and I probably should have been. Not that work shouldn't be stressful because y'all, it just is. I mean, work is work. It's never going to not be
Yeah.
stressful. It's a job. But I didn't know what I didn't know. So I think that's what we're trying to prep you for is that we can kind of go through some examples of things that we struggled with and questions we wish we would have asked, and how our program can kind of help prepare you for that as well.
Absolutely. I can remember. So when I was a CF, it was my first week, and I had a brand new kiddo. He was from insurance coming. He was 18 months, no diagnosis, just brand new, struggled. And all I got was he's struggling to communicate. That's the little blippet that I got, which is normal. You don't really get much input. And he came, mom was 45 minutes late to her 45-minute appointment. She got lost. She was, oh, poor mom. She was driving around in circles trying to find the clinic that I was working at. The little boy got car sick on the way and puked all over himself. Came in and she like washed him off in the sink. He put him in a diaper and like sent him in my room she came in the room with me, and he was so dysregulated and just all over and just tearing everything down. And I think I probably looked like my eyes must have been giant because I did not know what to do. Now I do. Now I know where to start. But back then, just thrown right in, I had no idea what to do with this extremely cute little 18-month-old who was just destroying my room. And he was crying and just so upset. And mom was overwhelmed. It was kind of like, well, here, Nikki, here he is. I was like, okay. And that was, I mean, this kiddo was really, really, really hard for me as a therapist because all I wanted to do was help him and I didn't know where to start because he didn't have engagement in that back and forth. He didn't want to engage with me. When you're working with a child who is so dysregulated that they're kind of tearing things apart, that's how they're playing. He was exploring and doing these things, and he was frustrated. So he was communicating at the same time. I didn't know that. All I knew was he was having what we call behaviors. And it wasn't behaviors. He was communicating, but as a young, brand new CF, 24, new in the field, first week, I had zero idea what to do. And so I would always ask my supervisor, Janet, I need you to see this kid. But of course, he was the 5 to 6 p.m. kiddo. And she always had a 5 to 6 p.m. kiddo because you always have a 5 to 6 p.m. kiddo, prime time. Always. And for me, what I wish I would have known was just to stop and to just really focus on what he was doing and look at his receptive and understanding. So receptive language, understanding of language, focus in on that. And instead, I did what most SLPs, new SLPs, as well as parents focused on. What was he not doing, but what was he not doing with words?
Yeah.
We're not communicating at all.
You were probably thinking about the goals, right?
Yeah.
Like your brain was probably like, what are supposed to be the goals for this kid? I'm supposed to be creating a plan for this kid, and I have no idea what to do. But I got to get goals. Like there's just so much in your brain thinking like that.
This is even more difficult because sometimes our kids with insurance come with goals, and this kid did come with goals, and they were all expressive. Expressive goals.
Yeah.
So, brand new clinician, my goals are increase expressive vocabulary, use 50 plus words. You know, the general classic things, like 5 or 6 of them, and there really wasn't receptive language on there. And I think that's why I talk so much about receptive language with our new clinicians and CFs, because you cannot tease apart expressive language from receptive. If you're not doing something expressively, it's always got to be tied to receptive. Not always, but I would say the vast majority of the time, there's a receptive component to it. And so I just wish I had known. That's something I did not know that I wish I had known was how to look at a child to understand where to start, which is something that you and I are very passionate about teaching because it changes everything. And if I had known that before or right in the beginning of my CF, I think a lot of things would have changed with a lot of my clients. Not that I didn't make progress with them long term, not that I didn't figure it out, but I think I would have been a lot more prepared and I would have understood it a lot more. And I would have made progress faster. And I probably wouldn't have pushed some of these kids as hard as I did because sometimes you get stuck on it and you push because you're here to help. I'm here to help them meet their goals.
Mm-hmm.
And now we have this huge push for child-led.
Right.
And then there's, what does that even mean now? So I think it's all very fascinating.
Yeah.
But that was just a story for me. It was, this kiddo did make tons and tons and tons of progress. Yeah. But in the beginning, it was probably about, I would say even the first year, even past my CF, this was a kiddo that I struggled with.
Yeah. And it's because if you're just, when you're a CF and you're brand new and you get these clients that might feel a little bit challenging to you because you've never worked with children with these diagnoses, or maybe you have, but it was one or two kiddos at a school that looked very different than a private practice, or vice versa, right? At a private practice, but maybe you're in a school setting. It's a lot of new all at once. And your mind is going a million miles a minute thinking, okay, I can't disappoint my supervisor. I can't disappoint this family. I have to implement these goals, and I have to get data, because there's so much of a focus for whatever reason when we start treating as new clinicians on the goals and the data, and you've got to do the goals. And to your point, these goals weren't even appropriate for this child. But again, no one teaches you how to do that in graduate school, or that you could work in a setting where there's an IEP, or there's a private practice or a medical practice that has provided you with goals that maybe you need to change because they're not appropriate, because you're just grasping for straws when you're that new in your career, and you're just looking for any tool in your environment to help give you clues of what to do. And for you, it was those goals in that moment, like, well, this is all that I have. So what else am I supposed to do? But you needed the permission to know that it was okay to just take a giant step back and just build a connection with the child first.
I don't even know I don't even know if I needed the permission. I didn't know I needed the permission. So like, that's also, I think, what we're talking about. It's not even knowing. I don't think I would have known that is something that I should have done, or I could have done.
Right.
Because, I mean, to be quite honest, I was kind of like, shell shock. I don't know what to do.
Yeah.
So I paused, but I was pausing not for the strategic way that we think about with our CFs. And I think that is, it. Like, sometimes I think a lot of our clinicians don't even, it's not the permission that they need. They would give themselves permission. I don't think they even know, but I think you're right. It is like, how do you know that you can give yourself that permission when you don't even know that that's a concept?
Exactly. And those are things that you just don't know in your CF. You are thrown into a world filled with a variety of diagnoses, a lot of them you probably haven't worked with, and a lot of critical thinking skills, and where you're having to flex muscles that you haven't flexed. And so it's okay to be overwhelmed that first 3 months. It's expected. I remember it's also okay to not know what to say and to make mistakes, and you are going to make mistakes. And that's hard for us because SLPs, most of us are very type A, or if you're like me, you're kind of a combo of type A, type B. I'm type A with certain things with my work, but very type B kind of in the rest of my life. But for the most part, we're perfectionists, and we want to make everyone happy, and we're pleasers, and we're helpers, and we're empathizers. And so we don't want to do anything wrong. And when we do make a mistake, then it does sometimes feel like to us that the world is ending and someone doesn't like us anymore, and we upset that parent, or we're not providing good therapy, and that means I'm a bad therapist. And it doesn't, because we're humans, and you're a human, and your CF experience is meant to give you even more tools to grow as a therapist. You're growing as a therapist your whole career. So if you ever think you know everything, you don't. You never will, even with 40 years of experience. But especially your first year or two, or even 3 years, you are definitely growing a ton as a therapist. And so I think it's important to know that, because for me, I very much had an experience where one that sticks out for me was a parent asking me about autism and a lot of questions about the diagnostic process for autism. And I came in way too hot, and I didn't read the cues of the parent. And I told her that I did see red flags for autism. I remember saying those words, which cringe now. And I remember saying that I was concerned. I'm not saying you shouldn't say you're concerned. You should. But it was my delivery. And it was because I was terrified. This mom had a lot of really hard questions for me. I panicked. I knew a lot about autism because of my background. And I had a ton of experience. And I did a lot of diagnostics. And so I was like, I got this. but I wasn't overconfident. I honestly was just panicked in that moment. And I had a conversation with her, and I will never forget, she got so upset and she left the clinic and never came back. And I was heartbroken and devastated and thought, okay, I did this family a huge disservice. It's okay. They are fine. The child eventually got a diagnosis and is doing well. But again, I needed in that moment to know that it was okay to just take a beat, to just take a second, and to say to this mom, those are great questions, and I want to make sure that, I organize my mind and my thoughts and get this information to you in a way that is going to help support you along this journey. I wish I would have asked her more reflective questions. Yeah. I wish I would have coached her more. There's so many things, but again, when you're a CF, you don't know, you're going to make that mistake, but those mistakes are what led to the most growth and helped me be the clinician that I am today. So it's yeah.
It's one of those things, it's this balance, this delicate balance of making mistakes versus learning things ahead of time to help you when you make those mistakes, figure it out too. And I think that's, how hard for you, because you did have all of that diagnostic experience. So when she asked the question, you're probably like, ding, 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 these are all the answers. These are all the things that I'm seeing. I want to help. And we often come from a helping standpoint, because there's no bone in your body that's mean. So
no.
But that's most of us. There's not a lot of, like, no one's having these conversations trying to be unkind.
Right.
I think sometimes what happens too as a CF, we just talk.
Yes. Because you're so nervous. You're so nervous. Yes.
And it's like, actually the power would have been in the pause and asking, like you said, a reflective question. Well, tell me a little bit about what your concerns are. What do you see? However, see, those are the things we talk about. Yes, you can grow and you can learn from this mistake. You can also learn how to have some of these reflective conversations ahead of times to help reduce that mistake. Even if you take our program and you work with us, you're not going to not make mistakes. This isn't like come take our program, you'll never make a mistake in your CF. It's let's give you as many tools as you can so that when you make these mistakes, you can recover quickly and help the families.
Absolutely. And it's helping you just feel a little bit more confident, a little bit more prepared, and also what questions to ask, like you had mentioned before, right? What are some things that you could be talking to your CF supervisor about? Maybe you're having a tricky time with your CF supervisor and you're having a hard time getting in touch with them. Your communication styles are different. The way that they're providing you with feedback is not helpful for you necessarily, and you maybe need, but no one teaches you also how to have those conversations. So especially in the beginning of your CF, you just suffer through it. And it goes back to what you were saying, Nikki, about it's that rite of passage. Well, you're kind of made to feel, well, I'm a big girl now or a big boy now. I got to just push through. And no, that's what our program can help you do, is figure out what kinds of questions to ask, how to have those difficult conversations maybe with your supervisor, how to ask for more support, and what kinds of questions to ask. Because I just thought that was such a great point when she brought that up, the CF, about how I didn't even know what to ask, and now I know what to ask, because you don't know what you don't know in your CF. And we are telling you from experience and working with so many CFs and SLPs that we want to make your life easier and less stressful and continue to have you more passionate and excited about the field versus feeling super stressed. That's what our programs are meant to do.
Yeah. So some actionable things, if you've made it this far and you're listening with us, thank you for being here. Some actionable things you can do within your CF is when you get these kind of difficult conversations with families, pause and ask a reflective question. Tell me a little bit more about what you're thinking here. That can give the parent the leeway to tell you so you can understand some of the information they want you to address, because sometimes you might be addressing information that they weren't ready for, they didn't even understand, or they need a little bit of help leading into having some of these difficult conversations. Another one is pause. When a kiddo comes in and you don't know what to do, pause and focus on their understanding, that engagement piece and their play. And just don't worry about the goals right away. The goals are obviously important. However, this child in front of you and what they're doing today is more important. And we need to learn how to tie those in together. So those are two things I think that are actionable
Yeah.
when you start your CF. Just focus on receptive language and ask reflective questions.
Yeah, and for me, I would just remind yourself that you're processing so much information all at the same time. You're learning about all of your new clients at the same exact time as you're learning policies and procedures of your workplace. You're
Mm-hmm.
making new peer relationships. You're learning how to work with a supervisor, their communication style. You're meeting parents or you're meeting caregivers or family members if you're with adults. That's a lot of new. So it's okay to just take a step back and just focus on the connection with your clients, and that's it. Just focus on building a relationship, just like you would with a friend that you just meet, or a niece, a nephew, a kid that you've babysat. It doesn't matter. Focus on the connection, because if you don't have a connection, if you're not in a room with a child or in a room with an adult and you feel some sort of joy or fun
Mm-hmm.
factor or connection, that's what matters the most. That's what's going to ultimately lead to you being able to see and understand what their skills are and then implement the goals. So take a giant step back, and for the first several weeks, you're just playing or you're just having conversations a lot of times to identify the needs of the clients to build the connection. And that is so important. And that will also make you feel less exhausted, I
Mm-hmm.
think, at the end of the
Mm-hmm.
day, if that's your main focus when it comes to your patients.
Absolutely. And, it's a learning process. You can learn through it. You
Yep.
can join our program. We can help you identify those areas. You don't have to struggle alone, like you said. This is a community. We are a
Yep.
community, and it's important to know that there is access and there's no shame in needing more help.
Hmm.
It's really brave to be able to identify that this is a little bit hard. Why don't I get help before it's too late? So
Yeah.
never be afraid of getting some help. Help is always wonderful.
Invest in yourself, because honestly, no one else is really going to. And that's something that's always stuck in my mind. So, even if you have to invest in some training programs, it's worth it in the end, because it's investing ultimately in you and your success long term. It's worth every penny.
Absolutely. Well, we're running out of time today. Thank you all so much for joining us. We look forward to speaking with you guys again soon.
Thanks so much. Have a great day. Bye.